Hi, my name is Carly Walsh, and I am a senior here at Westfield State University in the Movement Science Department. I decided to focus my research on aquatic therapy and its benefits on cerebral palsy patients with varying levels of gross motor classification and various forms. Cerebral palsy is defined as a group of neurological disorders that leaves a child with various limitations physically. This affects the health-related activities and daily living activities. Aquatic therapy is a relatively new rehabilitation form among the cerebral palsy community and is considered beneficial due to the buoyancy of the water, anti-gravity positioning, and decreased compressive forces on the joints. After reviewing multiple clinical studies, common methods of activity used were both aerobic and anaerobic exercises, manual passive stretching, and functional training components. These were used to assess if aquatic therapy could improve cerebral palsy's gross motor functional abilities. Data collected demonstrated how a combination of thermal and mechanical factors increased gross motor function, gait and balance control, sitting posture, quality of life, and increased strength and endurance. In two studies, water temperature and water depth were researched. Adar S. Dundar's study concluded that keeping a pool temperature between 33 degrees Celsius and 38 degrees Celsius increases the body temperature, which leads to a reduced gamma fiber activity. The fiber activity leads to reduced muscle spasticity and increased muscle relaxing, leading to an overall increased range of motion. A study conducted by Hosseini looked at the effects of decreasing water depth every 5 minutes by 1 inch as the patient is walking underwater. The results showed that the patient's walking abilities and endurance increased by decreasing the water depth and taking away the water support. These two findings, along with many others, give clinicians a guide as to what techniques and environments will provide the best outcome to help the child's daily living activities. It is important to continue further research on aquatic therapy due to the physical and cognitive benefits. Even with beneficial outcomes, modifications can still be made in order to make research more conclusive and accurate. Changes mentioned among the reviewed articles were to use larger sampling sizes, extend the intervention duration to a minimum of 10 weeks. This way, clinicians are able to observe patients over a long period. And lastly, involve patients who have a higher classification level of cerebral palsy. This is important because it allows clinicians to extend the dimensions of research due to these patients being classified as lower functioning. By furthering research and implementing aquatic therapy interventions into schooling systems or alongside more traditional rehabilitation resources like physical therapy, occupational therapy, and speech therapy, aquatic therapy will provide cerebral palsy patients with a fun and adaptive rehabilitation resource.